Hi all, today we'll be discussing New Zealand's healthcare system. The New Zealand healthcare system is a universal public system. The passing of the Social Security Act in 1938 brought into law universal and free healthcare. The Act requires that all New Zealand citizens have equal access to the same standard of treatment in an integrated preventative healthcare system. The government operates it as a single-payer system and pays for the majority of healthcare costs using public tax money. However, the government does not handle the responsibility of providing healthcare services, leaving this up to regional and private healthcare centers in the system. Hospital and specialist care are covered if the patient is referred by the general practitioner. The system is a form of the Beveridge model, such as the one in the UK. Now I will move on to the history of the health system and its various reforms. Originated by Michael Joseph Savage through the 1938 Social Security Act, New Zealand brought into law universal and free healthcare. The Act combined a new free at the point of use health system with a comprehensive array of welfare benefits. It was financed by a tax surcharge, and supporters envisioned a scheme that would protect New Zealanders from the cradle to the grave. In 1983, as Minister of Health, Helen Clark was responsible for implementing major reforms under the 1983 Area Board Act, restructuring the country's 27 hospital boards and 14 area health boards with a population-based funding formula. The restructuring was intended to introduce greater local accountability and administrative efficiency in the face of escalating healthcare costs. The 1983 Act successfully kept health expenditure steady from 1980 to 1990, following a sharp rise in the 1970s. In 1991, under a national conservative government, Ms. Clark's area health boards were swept away and replaced by 4 regional health authorities headed by government-appointed commissions. Hospitals became Crown Health Enterprises with an appointed board of directors, and healthcare was funded through a market-driven competitive contracting. This was a radical departure from a system of community involvement in healthcare, which had largely been accepted by both political parties since the establishment of universal healthcare in the 1930s. In 1999, these monetarist reforms largely failed to produce the promised benefits, and the new Labour government elected in 1999 began to reverse most of its elements, including a return to community-elected district health boards. In the 2000s, a population-based funding formula was developed and was used to fund the district health boards. The Labour government also planned to propose taxes to provide additional health service funding. Taxation methods under consideration include a general tax, a social insurance model, such as payroll tax, or extending accident compensation corporation, which is primarily employer-funded, to include the illness as well as injuries. Sin taxes and private contributions, such as user payments and private health insurance, were also considered. In 2002, the Maori Health Authority was established. This marked one of the most significant changes in recent history. The authority was created alongside a newly created central government institutions, including the Health New Zealand and Ministry of Disabled People. The Howrah Maori Ministerial Advisory Committee was also created to be positioned alongside a slimmed-down Ministry of Health focused on stewardship and incorporating a re-established public health agency, replacing the community consultation elements of the country's disestablished health area boards. In 2024, New Zealand's conservative government introduced a new bill to dismantle the agency set up to improve healthcare outcomes for the Pacific Nation's Maori people. The Maori Health Authority will be shut down by the end of June, and its functions will be absorbed by the national health system. Next, we will discuss the demographics of.
Thank you, Fundy. I will now bring us through some of New Zealand's basic country information, starting with their geographical landscape. New Zealand is a part of the Oceania region, residing in the southwest portion of the Pacific Ocean. New Zealand is made up of 2 large islands and a bunch of other small islands. The South Island is home to more mountainous terrain, while the North Island has more urban living and houses up to 75% of New Zealand's population. In terms of ethnicity, New Zealand has a diverse population, with the majority identifying as European, and others including, but not limited to, Maori, Chinese, Indian, and Samoan. For religious practices and beliefs, Christianity is most prevalent at 37%, followed by Hinduism, Maori, Islam, and Buddhism. New Zealand boasts a current population of 5,264,258, with a growth rate of 0.95% and a migration rate of about 3.8 per 1,000. The life expectancy in New Zealand is averaged out to be about 82.9 years, with slightly higher age trajectories in women, and with the majority of the population lying between the ages of 15 and 64. Infant mortality rate is about 3.3 per 1,000 live births, while maternal mortality rate is 7 per 1,000 live births, an exceedingly high statistic. I will now go into a brief pestle analysis of New Zealand with a focus on healthcare. New Zealand is a parliament democracy with a constitutional monarch and has a significant political footprint in the healthcare system, providing up to 85% of healthcare funding. The government's largest body of work is seen in the Ministry of Health, which is an exceedingly powerful entity covering health and disability of New Zealand, as well as serving as a health policy advocate and source of funding. Economically, New Zealand is experiencing a 3.3% unemployment rate in 2022, showing a decrease from previous years. Out-of-pocket spending is below OECD averages at 13%. However, per capita spending is greater than OECD averages, coming in at $6,601 in US dollars. GDP on healthcare is still slightly below OECD averages at 11.2%, but is showing a steady incline from previous years. Socially, New Zealand's health system has both doctor-to-patient ratios and hospital bed-to-patient ratios scoring below OECD averages. These statistics influence patient satisfaction for availability and access to care, as it is only 64%. New Zealand invests great resources towards preventative care for breast cancer with high rates of screenings. However, as mentioned earlier, maternal mortality rates are at an unfavorably high rate. In technology, New Zealand's technology and digital services sector works towards improving e-initiatives and their health strategy plan. The New Zealand Health Strategy looks to improve patient engagement through portals and other innovations, and the New Zealand Health Partnerships is a group tasked with equipping the healthcare system with the necessary tools and resources. In 2022, New Zealand ranked 17th in healthcare innovation and 14th in health digitization. They look to increase AI integration to their health system in the future. Legally, the Ministry of Health serves as a powerful regulator alongside the Health Practitioners Competence Assurance Act. This act is a regulatory agent in place to ensure patient quality of care and safety by regulating practitioner performance and competency. They also enforce an annual practicing certificate the providers must register under with their chosen health area to make sure practitioners are not practicing outside of their scope of work. The Health Quality and Safety Commission is a national entity that also works at regulating the New Zealand health system. Environmentally, air pollution has a 6.3 per 1,000 death rate, which is seemingly lower than OECD ratings. Furthermore, New Zealand has an incredibly high UV index and radiation rating that increases population exposure to health concerns such as skin cancer and cataracts. In terms of primary health issues in New Zealand, coronary artery disease is a notable concern. It is considered the highest health burden in New Zealand, impacting the lives of up to 170,000 residents. It is diagnosed at a high rate at up to 1 in every 20 adults is diagnosed, and unfortunately takes the lives just as quick, as every 90-minute time span someone dies from heart disease in New Zealand. The second notable leading health issue is obesity. New Zealand has the third highest OECD ranking for adult obesity, with both adult and child obesity rates growing at a fast rate. Adult obesity increased from 31.2% to 34.3%, while child obesity raised from 9.5% to 12.7%. Childhood obesity is a huge concern in New Zealand and has placed children of low socioeconomic status at greater risk. The third burden of disease is cancer, that had close to 28,000 new cases registered in 2021. Over the span of 5 years, on average, cancer took the lives of 9,654 New Zealand residents. I will now hand it over to Olivia, who is going to go into the structure of the New Zealand health system.
Thanks, Jennifer. The healthcare system in New Zealand is primarily public, with about 85% of its healthcare being government funded through public taxation. The Ministry of Health is the public service department responsible for healthcare in New Zealand. They oversee and fund 20 regional district health boards, also known as DHBs. The Minister of Health is appointed by the Governor General and reports to the Prime Minister. Their powers and responsibilities are outlined in the New Zealand Public Health and Disability Act 2000 and other legislations. There's also Associate Ministers of Health that have delegated responsibilities from the Minister of Health. They assist in other government programs such as Pharmac, the ACC, and mental health. Health New Zealand is the newly established government entity that's going to take over the responsibilities of the DHBs. They started taking over on July 1st, 2022. The Ministry of Disabled People was created on July 1st, 2022 as well. This provides a whole-of-life approach for people with disabilities versus a singular health lens. And finally, the Maori Health Authority is an independent entity that was established under Peora Health Futures Act 2022. They ensured the health planning and service delivery for the Maori people. However, this will be absorbed by Health New Zealand on June 30th, 2024. Although every New Zealander has government-funded insurance and access to free healthcare services and treatments, approximately 30% of them choose to purchase private insurance. The Southern Cross Healthcare Group accounts for a majority of the private insurance market share at approximately 62%. Southern Cross is New Zealand's only national private hospital network, and they work alongside the public healthcare system by providing additional surgeries when public hospitals are at capacity. GPs in New Zealand are usually independent or self-employed, but they contract their services to the primary health organization of that region. This was overseen by the corresponding DHB. Pharmac is a Crown entity established in 1993 that's responsible for determining what medicines and pharmaceutical products will be subsidized. The Accident Compensation Corporation, or ACC, is a no-fault accident compensation scheme that fully covers medical services and treatments for cases that are deemed accidents. This compensation is available to New Zealanders as well as visitors and non-residents. The Technology and Digital Services Business Unit is an entity of the Ministry of Health, and they're responsible for implementing the government's digital health strategy. This includes innovations such as telehealth communications and wearable remote diagnostics. Public hospitals were managed by DHBs, and their services and treatments were free for citizens and permanent residents as long as there was a GP referral. In terms of social justice, New Zealand's government's overarching goal is to provide universal and free health care, which was established by their Social Security Act in 1938. Their current focuses are to promote accessibility and eliminate racism in the healthcare system. However, the existence of the private sector itself circumvents the New Zealand government's objective for accessible and timely healthcare for all citizens. This gives citizens that can afford private insurance an advantage in terms of speedier treatments and service coverage. I'll pass it off to Mary, who will be going over the coverage in the healthcare system.
Thank you for that information. Let's talk about the healthcare system coverage in New Zealand. New Zealand's healthcare system is comprised of public, private, and voluntary sectors. All citizens have insurance through the government-funded, universally accessible health services. In practice, however, coverage varies by income, need, location, and type of service. No citizen can be denied treatment in public hospitals. As shown in the graphic, 100% of citizens have public coverage, while 33% have additional complementary insurance. Private health insurance here is used mostly to cover cost-share requirements. Examples of this include elective surgeries in private hospitals and specialist consultations. Private insurance can also ensure faster access to treatment. Southern Cross Health Insurance is the largest private insurance in New Zealand. This health system is governed by the Ministry of Health, which has 20 geographically defined district health boards. Duties of the Ministry of Health include setting the overall healthcare policy agenda in the annual health budget. In May of 2021, the New Zealand government annual healthcare budget was approximately $17.3 billion US dollars. Let's talk about what is covered and what isn't covered under this universal system. The publicly funded system covers preventative care, inpatient and outpatient hospital services, primary care, maternity services, physical therapy, medical equipment, inpatient and outpatient drugs on the national formulary, mental health care, dental care for kids, long-term care, home health, hospice, and disability support. There are no deductibles, but co-payments are often required. Looking at the graphic, co-payments range from 10 to 50 New Zealand dollars for primary care, none for public hospital stays or consultations, and around $5 for prescription payments. Reduced co-payments are available as safety nets for those who visit a GP more than 12 times a year, are low income, or 65 or older. Services notably not covered are optometry, adult dental, orthodontics, physiotherapy, and ambulance services.
Thank you very much. We will now discuss the health system performance of New Zealand's healthcare. It's sometimes difficult to put numbers to quality of care, and it's easier to compare the performance to other countries. When using CEO World, New Zealand is ranked number 21 in the world on quality of healthcare. This is below Germany, Singapore, the Scandinavian countries, and the United States, but above the United Kingdom and France. Using the Legatum Prosperity Index, which includes healthcare but also quality of life, governance, and living conditions, it's even ranked higher at number 10. When looking at the overall quality, the life expectancy in New Zealand is excellent, with 83 years, and infant mortality is very low, with only 3.9 per thousand births. Several analyses have been performed by the New Zealand government on the strengths and weaknesses of New Zealand's healthcare, and these are publicly available. In general, New Zealand is well known for their effectiveness in care, the fact that their healthcare is relatively inexpensive when compared to the quality they get, and there's a large focus on infection, and there are very low incidences of sepsis and other infections. Weaknesses consist of inequity, that we will discuss much later, and the variations in level of care. The Ministry of Health published a report in 2016 on the Healthy Aging Strategy, as this is one of the largest challenges in New Zealand. They aim to focus on the topics of aging well, acute and restorative care, living well, support for people with high needs, and respectful end of life. When reviewing the costs in the New Zealand healthcare system, these seem to correspond to the quality of care for developed countries, with 11.2%, which is similar to other countries. There has been a significant increase over the last 2 decades, and New Zealand is focusing and working hard on reducing these costs. This has already resulted in a change of the healthcare system, as previously discussed, where they move more towards an NHS system, as is known in the UK, and we know as the Beveridge model. In general, all people in New Zealand are covered by public insurance, and 33% has additional private insurance. 80% of the costs are collected from taxes. The greatest challenge for New Zealand regarding the cost is the so-called double hit phenomenon that is occurring right now. This means that not only the population is aging very quickly, and it's predicted that 25% of the population is over 65 by 2040 and 2050, but it also means that the amount of people that are working and paying taxes is getting relatively smaller. This is a problem because the healthcare system in New Zealand is built and based on tax collection. If you have less taxes and more people to take care of, you get into trouble. This is why New Zealand, as discussed previously, is transferring to a different healthcare system where the government takes all the costs upon them so that they can A, better regulate the cost, and B, have better control of what they can get in terms of revenue for the healthcare system. It's already been discussed that the Health New Zealand system is currently active, and they're working on this to reduce the cost. When we're looking at access, we mainly look at affordability and timeliness. And when we look at the top graph, we're looking at the cost-related problems of getting access to healthcare. And we see that this is relatively common in New Zealand. This is mostly associated with the Maori and Pacific people. And we even see this in children, even though this has become free for children to visit doctors. Looking at timeliness in the middle chart, we see that same-day or next-day appointments are very common in New Zealand, and there are no issues for that. Regarding elective surgery or waiting longer for elective procedures, we do see New Zealand has longer waits, which is something that reminds you of the Beveridge model in the NHS. This is a bit concerning as they're actually moving towards that system, and this is one of the future potential problems. We see that cost-related access and timeliness are one of the major challenges for the New Zealand healthcare system regarding access. Since 2015, for children, healthcare access has become free, but even now we see in some cultures, especially the Maori and Pacific, that people are not aware of this or still having trouble or think that they need to pay for healthcare access. When we're looking at strategies, they're focusing mostly on decreasing barriers, a better outreach, and more satellite programs so they can also reach the areas that don't have hospitals nearby. We also notice that they focus on waiting times as they try to centralize healthcare, and they have more doctors compared to the UK, and they hope to address the waiting times this way. The biggest challenge for New Zealand healthcare is the equity, and that is one of their main pillars to move to a new healthcare system. There are significant disparities, especially for the Maori and Pacifica people, as there are differences in life expectancy, work lifestyle behaviors, and COVID infection fatalities are, for example, way worse. The Maori, another challenge is that the Maori want to focus on self-governance, and they do not want to be told by the white European New Zealanders how to run things, including healthcare. Although the Maori and New Zealanders work really well on the All Blacks rugby team, there are definitely struggles regarding healthcare and the organization of this. Initially, it was thought under Health New Zealand that the Maori and the New Zealanders would have a separate governance to run healthcare. However, upcoming June, this will be abolished and the Maori will fall under the governance, which is definitely a problem under the Maori people. New Zealand will focus mostly on lifestyle diseases, especially when considering equity. We will now discuss the innovation part of New Zealand's healthcare.
Thank you. I'm excited to share how New Zealand is transforming healthcare through innovative strategies. These advances not only improve patient care, but also make the healthcare system more efficient. Let's start with the Health Information Platform, or HIP. This digital system collects health data from all over New Zealand into one easy-to-access place. It's especially useful in emergencies, helping doctors quickly see patients' full health history. This tool shows how technology can make healthcare faster and reduce unnecessary steps. Another innovation is New Zealand's responses to the COVID-19 pandemic. They use a go hard, go easy approach with quick lockdown and strict borders control. This method effectively stopped the virus from spreading widely, allowing New Zealand to get back to normal life faster than many other countries. The next New Zealand Innovation Hub plays a crucial role. It helps turn health technology idea from doctors and companies into real products. For example, it has supported the development of a new medical devices and electronic medical record systems. This hub is key to bringing innovative healthcare solutions to life. The New Zealand Health Research Strategy 2017-2027 envisions a world-learning health research system by 2027. It emphasizes research excellence, partnership with Maori, and impactful collaboration aiming to prioritize investments in health research that deliver the most benefit to New Zealanders. In conclusion, New Zealand is making strides by incorporating cutting-edge technologies and effective management strategies into healthcare system. These innovations are addressing today's challenges and positioning New Zealand as a leader in effective and efficient healthcare. Thank you.
Before I jump into the ways that New Zealand health system has been working on improving, I want to highlight the major challenges that New Zealand is currently facing. One article that I read summed up this first challenge well by saying, New Zealand has underinvested in healthcare infrastructure, but more damaging than this has been its underinvestment in its people. The demand on the system has only been increasing as the population continues to grow and age. There are shortages in general practitioners, causing very long wait times throughout the nation and also strain on the emergency departments, as the citizens are being forced to go to these resources as they cannot get appointments elsewhere. Part of this issue is caused by the lack in pay that junior doctors are receiving. With strikes happening throughout the nation, It is estimated that about half of the junior doctors in the nation are on strike due to over 600 positions being in line of a substantial pay cut. This has caused many of the doctors to threaten to move to other nations to work instead, and some have left already, as out of all of the Oceania healthcare systems, New Zealand has the highest dependency on overseas trained doctors, with 42% of its health workers actually being international grads. The pay cuts are due to the challenges that New Zealand health system is facing in the rising expenses. There are needs for reallocation of money so that New Zealand can begin to invest in its doctors and then improving both infrastructure and the healthcare centers. The financial struggles that the healthcare system are facing is causing the country to fall slightly behind others in the innovation of new technology as well. To combat the challenges that I just spoke about on the previous slide, here are some potential solutions that New Zealand is doing to currently work on the issues within the system. To begin with, the 2022 restructure of the healthcare system included a multi-year budget to move towards a single healthcare system throughout the entire nation. Although this has upset the second largest ethnic group, as they are losing the Maori Health Authority, the plan is that this should help the system come together as one to correctly spread the money to the needed parts of the system. There was an increase of over $3 billion to invest in over 2 years, and this plan is to help create greater consistent care throughout the entire nation, as well as increase the workforce development. Along with this, the government has been working on promoting the healthcare workforce and creating better plans for the lack of healthcare workers in the nation. The Health Workforce Plan, which was written last year, outlines the commitment to streamlining pathways for districts of the nation to enter the healthcare workforce by rolling out specific academies around the nation and scaling the programs. This also should support the diverse communities to enter the workforce. Along with this, there will be coherent healthcare working training system and investment in the current junior workers that are seen as the next generation of clinical leaders. The government also plans to recruit more overseas by accepting overseas diplomas and creating quicker pathways for those doctors to become citizens. However, there are some critics saying that the government solution for healthcare worker shortages is just being patched up with the short-term solutions of attracting overseas trained workers, with the promise of the quick pathways to citizenship. This idea might be true because one area the system still needs improvement in is the need for more medical schools, as there are only 2 in the entire nation. And of these 2, the graduating classes have seen to only have 25% being general practitioners. New Zealand needs to create greater incentives for citizens to attend medical school within the country, as well as greater incentives for those who are attending to become great general practitioners to help the nationwide shortage. Overall, New Zealand is making good proactive steps in the right direction, but there are, of course, still areas of improvement. As we discussed in the first couple of slides, New Zealand went through a large restructure plan in 2022. During this restructure, there was a budget reform where the Ministry of Health invested its largest amount in history into the healthcare system. Within this investment, there was about $400 million allocated for greater data and digital capabilities. This investment into digital platform improvements helps the nation move towards the shift of becoming a single health care system throughout the entire country. With greater technologies, there are administration burdens removed for healthcare workers, making delivery of care more streamlined and overall greater accessibility. Although New Zealand can continue to work on providing equitable healthcare to all, this budget reform has also allowed for the introduction of telehealth, which has been seen to improve care in rural areas. Other improvements, such as HERA, which is a platform where patients have their digital health records stored, There is ease on both the patients and the healthcare workers' overall experience in scheduling and accessing records so all doctors can know the patient's history. Thank you so much for watching our presentation. We really hope you enjoyed it, and if you have any questions, feel free to leave a comment and we'll get back to you soon.